置き薬というのは日本で今から330年ほど前、富山というところで、起こった薬の配置システムなんですけれども、箱の中に家庭に必要な薬を前も置いておくと。しかしその時にこの薬を売る業者さんはお金をもらわないという形でそのまま家庭に薬を置きます。そしてその過程でいざ子どもが病気になったりした時に薬を使いますが、それは自由にその薬を使ってよろしいと、その時にお金を別に払う必要もないという形になります。そして、半年ぐらい経った時に今度は業者さんが来て、その箱の中を見て、この薬を使いましたねと、じゃあこの使った分の薬をくださいといった形で、薬の代金をその時にもらうという形になります。でそして同時にその業者さんがじゃあ使った薬の、新しい分を補充しましょうといった形でまた薬を置いていく。その時にその補充分についてはまたお金をもらわないというような仕組みになってまして、これはその置き薬の専門の方々の言葉で言いますと、専用小売という言葉で皆さん表しています。専用というのは、薬を先に使うということ、そして小売というのは、後でお金をもらいますという考え方、そのシステムを一言で言って専用小売、すなわち先に薬を使ってください、その時にお金はいりません、後で払ってください、そういうふうなシステムです。このモンゴルの、事業は2004年1月から、始めました。
مكشد طلغت حقائد خطر درن تموت للكية درنا صغير ججغن نانن صغرنا صغير بجحر دنخر دم سبرنا صغير بجحر دنخر دم سبرنا هجو خبير تاسم كيمر تقوينا Mustaqtık benim Hacım kulin turgan Kudarksın Olgar Amgayra saçtım Murskid oya Sırgın Arayadım Taktakın Fulbur içine.
Well, as you know, Mongolia is a very wide and big, and also we are a nomadic people. So as compared to other countries, we are living the people, families who are in the countryside, they are living very far from each other. And also the Son, this is the villages of the provinces are located also very far from the center. So that's why the people who are living in the countryside or remote area, this is sometimes very difficult to reach the medical services. That's why, as compared to the area, people who are living in the cities, our Mongolia, our country is a little bit different because the people is very far from the center, and this project is also one of the brilliant ideas, and one of the unique things is we trying to reach every single families, even they are living in the mountain areas, in the remote places, you know. Well, at the very beginning, we have some problems of the medical services who are living in the countryside, because, as I mentioned you before, when they are in the countryside, when they are close to the mountain area or far from the village center, difficult to get the medical services. When they have some problems, when they have accidents or some medical service needed, they have to go to the village center at least 20 kilometers. 30 kilometers, some places 70 kilometers. So people were when they had problems, some people cannot go. By our project, they have a own medicine kit in the home, so they can easily use the traditional medicine, easily can treat themselves by themselves. Some results of the village report, it says that 40% of the local doctor calls decreased. That means the people, when they got a just fever, when they got a cold, they don't need to go to the center. They can use the medicine from the medicine kit by themselves, and also they know how to protect themselves. Because before we were thinking about to use the medicine when they had problems, when they are sick, But right now people was thinking about how to protect themselves. Well, at this time the Mongolian government cannot provide the whole medical service to all of Mongolia. As I mentioned to you before, that we are the nomadic people, especially who are living in the countryside, who have the cattle, livestock. They are moving around at least 4 to 5 times in the year. That kind of people is difficult to find out the medical services. That's why Mongolian government trying to help it, but still not good enough. So additionally, our project is very helpful and useful and very efficient to the people who are living in the remote area. So I strongly believe that the government of Mongolia will continue this project in the future, because after doing this project several years, now we can understand, and we have a lot of very positive thinking and thanks from the local people, because it's very efficient, because it's very useful, and also they even understanding about their self-protection, how not to be sick, how can they, if have the problems, how can they treat themselves. There are a lot of educations they got it. So I hope that the government of Mongolia will continue this project by the government.
My name is Dash Guru. I'm 24 years old and we've been married for 5 years. These are our 2 children. Her name is Tsete and our son's name is Tsanimdu. We are herders. I've been living in the countryside helping out our family since I was very little. So I decided I wanted to be a herder too. We've been using the Okigusuri box since 2008, when the project started here. In the beginning we used the cough and sinus medicine, but last year, after I delivered my son, I used the medicine called shimshi, which is for mothers who just delivered. And these days I use the medicine for kidneys. We've been using it a lot because it keeps us well. At the beginning, when we heard about the Okigusuri, we found it was very useful because it contains medicine for first aid and to disinfect. These are things that we use a lot here. We found it was very convenient since we can use it first and pay later. So we thought it was a good idea to try it out. Most of the families in this area were happy to get involved with this new healthcare system. These medicines in the Okigusuri box are produced in Mongolia, and they are also Mongolian traditional medicines. So, as Mongolians, we should support this project because it promotes our national production. My name is Briantse, and I am 62 years old. I've been using the medicine box for 2 years. It's not very difficult to use. I use it on a regular basis. I mostly use all of the medicine, especially the one for the joints, and also the ones for cough and flu. I use 2 medicines, one for flu and another one for cough. I think it's good for you. I use the medicine in spring and winter the most. I drink the medicines in the morning and evening, but only when I don't feel so well. The medicine box is very convenient, since you can pay when you have money.
で現実的にじゃあ今どうやってるかと言いますと、そういう地方の方に地方の病院で働くお医者さんたちがおります。 そのお医者さんたちが1ヶ月に一度ぐらいはその遊牧世帯を訪問して、そしてそこでその住民の健康診断とかそういった時をやりますから、その時に彼らが同時に置き薬の箱をチェックして、中のどの薬が使われたか、使われた薬に対してはお金を代金をもらって、そして同時に彼らが新しく持ってきている薬を補充していくと、そういうことをお願いいたしまして、それが今実際にこの実行されております。
I work with this project about 2 years. I think this project is really good for Thai people to promote Thai traditional medicine in the village, not only in the hospital, to promote in the village. And because many patients they have the symptom, in some cases they cannot go to the hospital. Some cases they cannot go to the hospital. They can use the Thai traditional medicine in their family by themselves. In the future, if this project expand to the other province in Thailand, we can use Thai traditional medicine in the family care in every province.
In Thailand, we have the promotion of the use of medicinal plants in primary health care. We select about 60 medicinal plants for people in the community to grow and use. Okay, they can grow it in their household area and then pick that herbs when they have particular diseases. That is one way to promote the use of herbal medicine or medicinal plant. But sometimes that might not be that convenient for nowadays lifestyle. So if you have ready to consume medicine in the house for commonly found minor ailments, that would be okay. That's a good way to promote the use of herbal medicine because it is easy to use. So I think that either way is good. I mean, using the fresh medicinal plant prepared by yourself or the one prepare in the box, either way it's promote the use of herbal medicine, and I think it's okay for me. when we found this project, one of our professor, our senior officers said that actually Thai people have that system before too. We made the traditional remedies in the form of like say ยาตำราหลวง which is composed of different medicine that you can buy the whole set and put in the like a medicine box in your house. This is another way. It's like a medicine box in the house, but it's a herbal medicine. So I think that it's the same principle that can be applied. I mean, in Thailand. So to collect medicine, maybe they're not getting used to that. Buy use first, buy later, things like that. But usually they probably more getting used to probably buy their own and then put in the house. But I think that system might work well too. I mean, just use first and pay later. But have to orient the community about that system, but I think it would work well with the remote area.
My name is Taruan Kanta, but everybody calls me Fern, and I'm in 6th grade. I have a little brother and my parents, so we are 4. Both are working in the tobacco gardens. I wake up early in the morning at 4 a.m. Then I take a shower and get dressed. Then I go to the market to buy food to make breakfast. Once we finish eating, I walk to the school bus to go with my friends. Once we get to school, we salute to the flag. Then we study until lunch and then study until 6 p.m. Then I go back home, change clothes, wash the dishes from the day, do my homework, and then I go to see my grandpa Lun. Grandpa Lun is my only grandfather. He always stays with my grandmother. I like him very much, so I stay with him the most that I can. He has back pain problems, so I help him put on the medicine too. I often use the medicine in the box, especially the anti-cough syrup for myself and back pain cream for my grandfather. I want to have my own restaurant where people can tell me what kind of menu they want to eat. And I make it. I want to study agriculture too, because I don't want to buy the vegetables for my restaurant. I want to make them myself. I know that in Japan there are a lot of earthquakes. I like to see the news, but I also love Doraemon. I want the children to be considerate when they study and be good people to their community. The medicine box has enough medicine for all my family and for any minor disease, so it's important to me.
The thing is that you need to supply them with the knowledge, research knowledge, that okay, these herbs really work because it has study to support. Also in Thailand, first of all, you need to convince the medical doctor as well, because they are the big force in the healthcare system. If the doctor prescribe, then the patient use. In the community, probably you have that. The thing is that the challenge is to educate them, and that's because some of them probably not familiar with the herbs that we selected. So that's a thing that we need to familiarize them with the content inside, more reliance on themselves, and know better how to take care of themselves by using herbal medicine provided in a box, medicine box, and probably visit the hospital less, hopefully.
このプロジェクトはもともとその持続可能なプロジェクトにしていきたいという願いを持っています。それは日本でもそのビジネスベースで、330年間、続いてきており、現在もそれが行われていると、ビジネスとして生きているということを考えたときに、おそらくその他の国でも、ビジネスもしくは国の政策として、実行できうるのではないかというふうに考えています。で、ただしそこには必ずこういう活動はその人の命を守る活動であるという一つのその倫理的な気持ちが強くあれば、途中難しいことがあっても諦めることなく続くんではないかというふうに思うのです。ですからこういう活動に携わる方々には単にその国の政策だから、やっているんだとか、単にその金儲けをするためにやっているんだということではなくて、その人の命を守る、人の生活を守るという一つの使命感といったものがぜひ必要だろうというふうに思います。ですからその政府でなされるにしても、皆さん関わっている一人一人の方々が この薬がきちんと家庭に供給されることによって人々の生活が守られるんだ、命が守られるんだというそういった気持ちを持ってやっていただくのが一番いいんじゃないかというふうに思います。
What the